I thought that Oliver did a brilliant job of presenting really complex ideas, and I'm not at all sure that I can compete with that, so I'm going to do my best, and we'll see how it goes, okay? So, my task today is to talk a little bit about the medical applications, and I want everybody to know right up front that I'm very much a learner. I've been learning from Kesh for about 18 months, applying what I can in the time that I have, and my own history is that I started as a Steiner pupil, completely unaware of what I was being taught, and I remember thinking at some early age, when standing in a row across a field, a biodynamic field, spraying some sort of dilution of manure across a field, that I was in some sort of a madhouse. But it's interesting because actually over the years I've gradually learned about what it was that I was doing as a young child and the value of the biodynamics and the information in the water and all of these things. A friend of mine who's here, somewhere here, introduced me to Victor Schauberger, and I always was fascinated by invention, and I wanted to be able to be an inventor, and I wanted to study invention, and there is no such thing, so I studied industrial design. Victor Schauberger taught about implosion and the opposite of what we're doing, which is explosive force. Everything we're doing is explosive, and he talked about the cooling nature of plants and forests and so on. And it fascinated me, and I kind of left it at that because I didn't know where to go with it. So I studied industrial design, found that the study was fascinating, but the work was not very interesting. I then studied nutritional medicine, and again I was kind of thinking, well, this is very limited. I don't really get enough from this. And then I came across Dr. Klinghardt, and Klinghardt teaches the 5 levels of healing. So he's very much about physical injury, physical repair, electrical injury, electrical repair, mental injury, mental repair, and that there's a downward causation and a slower upward causation. So then with that background, I learned a bit more. I wanted to take it further. I could see that it wasn't all physical, and I wanted to be able to be very targeted, so I then learned field control therapy. And field control therapy, as a teacher of mine right here, is a very interesting combination of arts and sciences, and uses sarcodal homeopathics. So a sarcode is a homeopathic of an organ tissue. So what we're trying to do with field control therapy is recognize that the field has been disrupted in an organ, and we try and tune that organ back in. We try to give the message back to the body so that it can retune and respond and get back on with the job that it's supposed to have in hand, but it's all from an informational point of view. So that's how I then came on to the work of Mr. Kesh. So I don't know if any of you have come across this guy, but there's something called the Semmelweis effect. In 1847, Semmelweis had the mad idea of washing hands, or asking surgeons to wash their hands before assisting in child labour. Women were dying by the thousand because of infection, except they didn't know about infection. So he came up with this mad idea that he couldn't see what it was that was happening, but if you wash your hands, he was convinced that this was going to eliminate or massively reduce the deaths. And sure enough, it did for those who applied this new concept. But the vast majority of people didn't understand it. It flew in the face of all the knowledge that was around at the time. The paradigms that they had didn't support the idea that you should wash your hands and get rid of something that nobody could see. So he actually died at the age of 47 in an asylum because his idea was completely rejected. Those that applied the knowledge reduced the death toll by 99%. But the vast majority of people just ignored it, and millions of, or tens of thousands of women, I'm sure, died as a result of ignoring something that was outside the existing paradigm. So he was solving a real problem. It was an obvious problem. And a lot of us today don't think there's a problem. Perhaps in this room it's different, but if you go out into the public right now, the vast majority of people say, well, you know, life length is increasing and health is improving and so on and so forth. But if we look just at autism up there, 1 in 48, this is the official American figures, 1 in 48 children born this year, or 2016, will be on the autistic spectrum. When I was a child, it was 1 in 10,000. Something is very, very wrong. Diabetes, 1 in 4. Obesity, 1 in 3. Major depression, 1 in 2. Cancer, 1 in 2. Heart disease will result in 1 in 3 deaths. And every single one of us is expected to have cognitive decline by the time we die. There's a real problem, and we need to do something about it. So where do we go from here? So the only scientifically valid solution to any problem is to identify and remove its true cause. And then the question is, well, what's the cause? What's the cause of the cause, and what's the cause of that cause, and how far do we go until we actually get to a point where we can influence the primary cause and have a cascade of positive outcomes? And that's what this is all about. So why is human health collapsing? This is a great image, I love that. Is it infection? If it's infection, is it the immune system? Or is it the cellular metabolism? Or is it the microbiome? Or is it all of these things? And if it is all of these things, or one of them, what is causing the breakdown of the immune system? What's causing cellular metabolism breakdown? And why is the microbiome failing? There are so many ways that we're introducing these toxins and these problems that it's almost impossible to go through them all. But we have heavy metals to consider, pesticides, solvents, we have petrochemicals and pharmaceuticals, and all of these things are influencing us in a negative way. And really there are no easy solutions. I'm sure many of you have come across heavy metal toxicity and know how difficult it is and how time-consuming it is to get rid of heavy metals once they're in the system. Jennifer Seneff has presented some fantastic work on glyphosate, and glyphosate is the active ingredient in Roundup. And she marries the curve in the growth of autism with glyphosate absolutely perfectly. And glyphosate actually chelates things like aluminium. It grabs hold of them, it wraps up aluminium, which has got a positive charge, and the positive charge stops the aluminium from crossing the gut barrier into the bloodstream and stops it from crossing the brain barrier as well, blood-brain barrier. But if glyphosate gets hold of the aluminium, the positive charge is gone, the glyphosate crosses into the bloodstream, then up into the brain, the aluminium is released, and all hell breaks loose. So it's just one chemical. There are thousands of chemicals out there and toxins. So where do we go, and what is the solution? So what is the cause of the cause? Why is mercury poisonous? What makes mercury toxic? Why is another element not toxic? What's the difference? They're all electrons, protons, and neutrons, as we're taught, but some of them cause devastation and some of them make us healthy. So right there we have to ask another question, what is it? If they're all electrons, protons, and neutrons, we must be looking at the field. And this comes back to field control therapy, but it also comes to all of the work of Mr. Kesh. It is the field that is important. So we've had a very good explanation earlier by Oliver as to what plasmas are, what Ganses are, and so on. But I'm going to take it back just to a very basic observation regarding the CO2. And it's Mr. Kesh showing us the leaf. And the leaf has a shiny surface, and underneath it has a matte surface. And these in nature, they're two of nature's nano coatings. And these nano surfaces between them literally pull CO2 into the leaf. It's not passive, it's active. So the CO2 is drawn into the leaf. The carbon dioxide comes into this leaf because of the arrangement of the magnetic and gravitational forces from that leaf. And we've found a way, or he has found a way that he's introduced to us, where we can do the same thing. So where Oliver was showing this morning that you can have a nano-coated copper plate and a zinc plate in a salt solution, and that pulls the CO2 into the salt solution, what we're actually doing is replicating the leaf. So that's up here. Then this statement that Oliver used this morning, to know and not to do is not yet to know. My position really is that I'm not a scientist. I'm watching all of this with fascination, but I have no idea if it's true. The only way I'm going to find out is by applying some of these ideas. So the first thing I did was to nanocoat a piece of copper wire. This seemed like the simplest thing I'd heard of that might or might not make a difference. So I actually did a flame coating, which is probably not the best way to go, but I took a meter of wire and I burned it until it was nice and black all over. And then I sleeved it with straws, long lengths of straw. And my wife, fortunately, over there, is very energy sensitive, but also she had a bad neck and a frozen shoulder. So I simply took the wire and wrapped it a few times around her neck and around the shoulder, not too tight. And yeah, sure enough, there was huge relief, huge relief. So right there I saw that there was something to what I was learning, and that's what I would encourage everybody to do. Get involved, get engaged, try what you feel comfortable with. Don't do anything silly, but just gently observe what you can, because the current science might disagree with a lot of what's going on, and if you're not a scientist, you're not going to understand enough anyway to argue either way. So the best thing is to experiment and experience and find out for yourselves. So the next thing I made was a health pen. The health pen, you can see there are three pieces to that. There's the stylus, which is at the top. There's the inner coil and the outer coil, and one of those is gravitational, which pulls the field forces in. There's one which is magnetical, which blows the fields back out again. So you've got this reciprocal arrangement, out and in and out and in. And then the stylus projects the fields to a point, and that point is what was shown to make the differences in the water, the frozen water. You can see the bubbles in the water making these beautiful shapes, and that can be pointed at a person to create a flow of plasma fields to and from the individual into the pen. So then I got the experts in, and that's our kids. And we played some more, and we made some more Ganses, and you can see like an oily slick on the top of this one. This is amino acids, and the amino acids are very important in the health Ganses and plasmas, because that seems to connect with the physicality of the body. So I made an awful lot of different Ganses in different ways. I also experimented with coils. The health unit that was briefly shown, we'll look at it again, is made of the same coils as in the Magrav. This is a Magrav here. And these coils are magnetical and gravitational, so one out, one in. But they're arranged differently, and I've got some here. They're arranged differently in the health unit, so you have them at 90 degrees to one another. And I experimented with that as well. I also made a health cup, which I'll show you over here in a little while. But I was really just learning, seeing what I could do. And some of the applications are very sophisticated. The whole health unit is a huge, huge endeavor that takes many, many, many hours, and I simply didn't have the time. But I had the time to rig something up and play with it and work with it and get to know it. And I had the time to make a few health cups. And then I began to apply things to see what I could do. So over there you can see the greeny blue is a copper Gans, and the one next to it is a CO2 Gans. And I started making patches of copper and CO2 and playing with them and experimenting with them. And I also made the Ganses in these tubs. That tub there is one of mine. And I would simply ask people if they would feel them, see if anything changed, and found that people had some great reliefs. Pain relief. One of my first experiences with was a gentleman. He was an older man, and he wanted to do a car rally. He had an old car with very heavy steering, and his right shoulder just didn't work. He couldn't really manage the steering, and he wasn't going to be able to make it. So I literally just got a couple of plastic bags with some wet tissue and poured some CO2 Gans on it and a little bit of copper, packed it off, strapped it to his arm and said, go and have fun, see how it goes. And he just emailed me at the end and said, yeah, I managed it, it was fantastic, my arm was working. Freedom of movement. Frozen shoulder has been able to move. Increased muscle strength. I had a young lady contact me. She's had Lyme disease and various other illnesses, and she's really neurologically compromised, and at the time she was having a very rough time and needed crutches or sticks to get from A to B around her room. And I sent her a CO2 patch. Might have even been a test tube of CO2, I don't remember. And I said, put it behind your neck and let me know. So she put it behind her neck, and in 5 minutes she could walk without a stick. Very interesting. The same young lady contacted me some while later because I also sent her a CH3. CH3 is the energy. I sent her a CH3 patch. And she said something really strange happened. I was going swimming this morning. NB, can't normally exercise in the morning. And on my way to changing, I took the CH3 patch out of down the back of my trousers, and my legs buckled. And she said the CH3 was the thing that gave me the strength to get to the pool. So she tucked it back in again, and she could continue to operate. Then I had a lady in America. I sent her a couple of CO2 patches for her wrists. She's quite a high flyer. She does a lot of computer work, and her wrists are agony. She needs a couple of hours of light therapy to her wrists every evening so that she can go in and do the same harm to her wrists the following day. And the CO2, over a number of weeks, reduced the pain and the immobility, not just in the wrists, but in the rest of her body, that she doesn't need the lamps anymore and only uses the CO2 patches every so often now. That foot there's mine. I damaged my ankle, and I used the CO2 and improved it. It recovered very fast. But just before it completely recovered, a wasp stung me in that foot, and the circulation was still not where it should be, and it got infected, and cellulitis set in. So I thought, I know, CO2 Gans. So I put the Gans patch on, and then I remember in the evening we watched some telly, and I grabbed another patch from somewhere and I whacked it on, and boy did it get worse. And it got worse because I put CH3 on it, and I hadn't realized. So often our failures teach us more than our successes. So I was beginning to learn that this is a science. There are applications that are correct, there are applications that are wrong, and I just did the wrong thing. So with the knowledge that I had so far, I wanted to find out if other people were having similar effects, similar benefits. And I went to Dubai, where I met Dr. Gouture and Alex. I met Vernie and Renan from the Philippines, and I met Dr. Azhar, who's from New York, she's Iranian, and learned that they were doing great things, much more advanced than me. They were finding that they were giving these Ganses and waters of the Gans, often just the water, not the Gans itself, to friends and relatives, and just watching and witnessing diabetes improving or going away. A lot of dental infections in Africa, apparently one of the problems is that with malnutrition and so on, the teeth become a problem, and the gums and gingivitis and all of these things. And they were finding that teeth were firming up. I learned from Vernie and Renan that they were working with the health unit, this is the big unit that we'll look at in a minute, the PENS, and that they were working to set up a hospital in the Philippines, purely dedicated to this, because the results were so effective and so cheap. So then we have to ask, why is working with the field forces so beneficial? And these are kind of paradigm shifts that we're going to have to go through to cotton on to what Mr. Kesh is talking about if we want to follow it logically. His observation is that 20% of our power, our energy, our nutrition, if you like, is coming through ingestion. And that 80%, this massive proportion, is actually coming from the environment. So just like the plants sucking in the CO2, we too are sucking in the CO2 and all of the other ganses and plasmas to our bodies so that we function. So where is the environmental nourishment coming from? It's coming from the sun. And we have the field forces of the earth and the field forces of the sun. We were looking at this infinity loop. And the infinity loop here causes friction here and brings about the manifestation of carbon, oxygen, hydrogen, and nitrogen, which are the building blocks of the amino acids. So we are, in fact, 96% made up of these four gases in nanostate: carbon, oxygen, hydrogen, and nitrogen. So it makes sense that that's where we should focus our attention if we want to get the biggest bang for our buck in health. So this requires a different way of thinking. We've all heard we are what we eat, but that might not be true. If that's only 20% of it and that's 80% of it, maybe we should be focusing over here. Maybe it's not all about we are what we eat. Maybe nutritional therapy is not everything. Maybe it's a fraction of it. Maybe it's almost irrelevant. It's not. But the point is that there is a huge piece of the pie that we've been missing. So how are the field forces applied? I showed you this little rig here. This is a little piece of a whole health system. The idea here is that you create a lower field one side and a higher force field the other side, and you drive the plasma fields through the body, normalizing the ganses in the body. And for those who've stood in one of these, they say it's like being in a breeze, being nourished. You see that there's a helmet here as well. Over here, there's just a pair of these health units, little ones. And these you can put a hand between, or a knee, or so. And again, it's all about exchange of fields from high to low, high to low, high to low, and normalizing whatever's in the middle. Some other ways of applying the Ganses. Douglas developed his health cup, and then we can see the helmet up here. And this is what's called a health cannon. It's much like a health pen, but it also had some gems in the bottom of it, and some, I believe this one also had some liquid in it, some plasma water. Then we have the pain pen, which we just described. It's made from the stylus in the middle, the two concentric coils, and it is absorbing the fields and delivering the fields. And again, this figure of 8, this infinity loop. It's all about pulling excess fields in and releasing, and pulling in and releasing and pulling in and normalizing whatever it is that's out of balance. I almost ignored that one. A few people know. I almost ignored it. This is somewhat deliberate. I've had these on order for people for about 7 months now. They've been promised every week since, and we still haven't got them. The news now is that next week, perhaps. So for those who are waiting, that's a plasma jug. It's an energizer, alkalizer, and the idea here is that we have the CO2 and zinc Gans in the test tube, and that sits in the water and imbues the water with the plasmatic fields, which you can then drink and take it into the body in a very simple, very easy, uncomplicated way that anybody can manage. I think it's going to be a great tool. So, which field forces should we use and why? And this comes to the creation of life. I know this is a big step to take, but I feel that we really have to include it as a concept to complete Mr. Kesh's teaching. And this is very recent information. This has only been taught in the last few weeks. We've understood that the carbon, oxygen, hydrogen, and nitrogen for the amino acids are the key. And then what Mr. Kesh says is that if you see these under a microscope, this is, of course, trillions of atoms altogether, but this is what the amino acid looks like in the gaseous state when it's not connected to the Earth and it hasn't been interacted with by other field forces. And this is where new life begins. And this is where intelligence begins, or the soul. And the soul is in that amino acid right there already. As the amino acid interacts with other force fields from the planet, on Earth, the interaction for the animal world is copper. And copper creates a division. If you can see right down the middle there, you've got a left side and a right side, and that left and right-handedness gives animals a left side and a right side. It also gives the brain a left side and a right side. And again, we have this reciprocal arrangement in and out and in and out. And that kernel right there is the soul. And that ends up right bang in the center of the brain. So just as the sun is the center of the solar system, we have a soul in the center of the brain. So certainly from the emotional point of view of Mr. Kesh's teachings, the soul is in the center of the brain, and then perhaps the physical soul is in the center of the heart. So now we have these two field force generators, left and right hemispheres, with the soul bang in the middle. And our soul is attempting to create and maintain its physicality through the emotional state. So this is the transition matter. The emotional state is the transition from the soul into the physicality. So there's always this communication up and down the body, always through the emotional state. And the suggestion then is that if the emotional state, the field forces generated by the left and right hemispheres, if they're out of balance, then that can lead to ill health. He's not alone. I'm sure many of you have come across what's now called Germanic New Medicine. Dr. Gerd Hammer developed testicular cancer after his son was shot in a freak accident. And he was so convinced that his testicular cancer came about through his emotional disruption, his emotional shock, that he went into further investigation. He was working in an oncology department where he was scanning cancer patients using, I believe, Siemens MRI equipment. And what he noticed was that there were ripples in various locations around the brain. And this has always been put down as a technical fault of the machinery, but if he moved the patient, the location of the ripple moved with the patient. And he then began to map out what he felt was going on, and he could after a while read an MRI and say, look, there's the ripple, that's the loss of a child, or loss of a connection with the child, and that's a breast cancer. Or that is a starvation issue, and that's a stomach cancer. And sure enough, the locations and the correlation in the body showed up very, very strongly. So we have there some observation of a correlation between the emotional, psychological interference and the manifestation of the illness in the physical body. Then we have the electrical observation. We know that by stimulating certain parts of the brain, we're making connections with certain parts of the body. You can't actually see it very well on this slide, but right here, this is the soul, and there should be waves coming out and then coming back in again. And again, this is the reciprocal arrangement of information in, information out, field forces in, field forces out. And although different parts of the periphery of the brain can be connected with different parts of the body, there's really no electrical, neurological, clear connection between nerves coming into the spinal cord and then out to these parts of the brain. So that connection is thought to be a field force connection, as taught by Mr. Kesh. So then we have the systems of the body. We have the blood system. And the blood system is nourished principally through breathing. As we breathe, we are working with the emotional state and communicating all of our emotional needs. Every single cell in the body, every single blood cell in the body has an address that it's going to nourish. Then we have the nerve system. And the nerve system is communicating the emotions of the brain through into the physicality. And the lymph system is then taking the plasma fields from the food through the lymph into the bone, where the bone is then nourished, and the nourishment then accesses the blood. So there's this complete cycle that's going on all the time. So the stomach releases plasma fields from the food. Oliver was talking about being able to go from plasmatic to Gans and physical, and then physical to Gans to plasma. So in this case with the food, the plant has absorbed the plasmatic fields, and what we're doing, we're breaking down those plasmatic fields, breaking down the matter state, releasing the Gans and the plasma into the body through the stomach. The bones then are like the plates. We've got a copper plate and a zinc plate in order to absorb certain field forces. And the lattice work of the bones gives the brain the opportunity to tune what it's trying to absorb where for which nourishment, which piece of bone is sending which plasma field to which organ. So that's another observation. The lungs, we just said, nourish the blood, and the heart is very curious because the heart is both striated and smooth muscle. The smooth muscle is under control of the emotion. The striated muscle is under control of the physicality, and the heart is both striated and smooth. So its job is to harmonize the requirements of the emotion and the physicality. We have the energy body. Now with Mr. Kesh's concepts, we actually have a source of that energy body, and that source would be the heart and the soul in the center of the brain. So we have a completely new perspective. Rather than simply making plasmas and ganses and so on and not having any idea why, now you have an idea why. What you're trying to do is you're trying to communicate from the soul through the emotion to the physicality and back again. So the four major ganses are copper, which nourishes the physicality. So we have copper and its isotopes, covering the full bandwidth of the requirements of the physicality. We have zinc, which nourishes the emotions. We have the CO2, which is the connection from the emotions to the physicality, and hydrogen to provide energy. So then we go back and we look at Douglas with his health cup. Douglas was ex-military and he was crippled with pain, and he started making ganses, just learning from Mr. Kesh, and Mr. Kesh really encouraged him, and he made himself a health cup. Now this is a cup, I'm going to try and hold it up with one hand. Here, let's take that lid off. So you have a straw going to the bottom, you have an inside of the cup, you have an outside of the cup, and it's actually a twin skin. So if I take one out of the other, you can actually create a copper insert which is not in contact with the fluids that you put in it. And then you put CO2 inside that, and
shall I show that one?
Yeah, you can pass that around. So now we have a better understanding. What happened was that Douglas got to the point where he could chop logs again, he could push his kid round on a bike, and he could take really long car journeys, and all of his pain resolved and his back injury went. And why is that? What was it that was going on? Well, what he was doing was he made a nano-coated copper. That's the copper, that's the physical. He then also added CO2 Gans. That's the connection between the emotion and the physical. And in that, there was some zinc, because every time you make it, you get a bit of zinc anyway. So he's nourishing his emotional, physical, and the connection between the two and that's what he got. If we look then at the pain pen, Gillen, our son, broke a tooth, and I was able to use the pain pen and instantly get rid of the pain, took it away, it came back again, used it, and he was very shocked. Didn't last, but it was a physical injury that needed more repair work. But of course the pain pen is copper, it doesn't have the zinc, it doesn't have the CO2, it's pain for pain. It's not pain for emotional pain. Okay, so now we start being able to make distinctions and say, oh, I want to use this for that. I want to use the copper because I'm working with the physicality. I want to use the zinc because I'm working with the emotion. I want to work with the CO2 because that's the majority of the body in the first place, and it's going to connect the emotion to the physicality. Same with the energizer, alkalizer jug, CO2 and zinc. So it's the emotion, connecting the emotion to the physicality. The pain patches. Now we have another way of working with the pain patches, 1:3 ratio. You can make 2 CO2 patches, one weak and one strong, and deliberately that sets up a field effect between the two, a flow from this one to this one, this one to this one, this one to this one. If you put somebody's shoulder between the two, now you don't just have a weak field, you actually have a traveling field that runs backwards and forwards right through the shoulder, and that will penetrate more. The plasma fields will penetrate a great deal more, as shown here. How am I doing for time? I'm using it up fast. Okay. So we're going to go quite quickly through this. So we've looked really at the emotional, physical, the connection between the two, but there are other things which are observed. When the Fukushima disaster happened, it was known to be pretty bad. The plasma technology was actually used in Fukushima, and there were safety studies conducted. And they found that by giving mice the tritium-enriched water, it killed them in 3 to 6 days. If they gave them the CO2 as well, they survived. Not only that, but when they gave them influenza, they recovered. So the killer for the workers in Fukushima was 1, immune system collapse and death through the radiation, and 2, death through influenza because the immune systems collapsed because of the radiation. And the CO2 seemed to compete with that and resolve it. We know that Chernobyl wasn't as bad as Fukushima, and people are moving back to Fukushima already. And the reason is that TEPCO must be continuing with the work that they inherited from Mr. Kesh. It's very interesting that the mice that managed to survive the radiation didn't have their livers and kidneys destroyed as they were eliminating these radioactive substances. And here we have a lady who has done a lot of lead, mercury, cadmium, thallium detoxification, but her values are still above normal. She then used the CO2 Gans and other Ganses for a period of time, and you can see that her values have improved greatly through using these things. These are not deliberate detoxification agents. This is something which is an outcome which is observed. We've heard from Paul in Togo and others in Africa that viral load drops significantly. There have been many blood tests confirming that some of the AIDS patients that have been worked with have had a far lower viral load. But it's not all about viruses, and the CO2 is very good, apparently, with viruses in situations of viral attack. But bacteria are somewhat different, and Mr. Kesh explained that the calcium in the immune system is particular isotopes of calcium which tackle bacteria. When these particular isotopes come in contact or close proximity with the bacteria overpower the calcium isotopes in the Gans state. And in doing that, they break down. And in breaking down, they break down from calcium to potassium, releasing beta radiation. I'm not sure if I've got the beta radiation release on here. Yeah, here we are. Beta radiation is released in that breakdown. And it's the radiation, as the calcium breaks down, that kills the bacteria. So then, again in Africa, in Ghana, Mr. Kesh has been making enormous strides, working with cancers and diabetes and AIDS and malaria. And this is processing, this is not curing, this is not treating the disease, this is just balancing the fields and allowing the body to make the recoveries that it can. They're now issuing waters, and these waters are able to be used. Elephantiasis is recovering. You can see that here the wound is opening up and the parasites are leaving. And this is a condition there's no answer for at the present time. For those of you who saw the Cancer Blueprint Day, Dr. Rodrigo, who's a 30-year veteran plastic surgeon, he took on a cancer case to see if he could help by balancing the fields. This is a very difficult case. The wound was already perforated, there'd been some antibiotics that had failed, the breast had swelled a great deal, and he took the case on. The first thing he did was breathing. The emotional state has to be balanced. The emotional state comes through the zinc. And so he developed one of many tools. There are lots of different breathing apparatuses, but in here he's incorporated the CO2 and the zinc ganses, and you're breathing a tube through those ganses. You're not actually breathing the ganses or any fluids, you're breathing a pipe that is surrounded by the ganses. And the plasma field that's being breathed in and being breathed out is harmonizing and balancing the emotional state. So after having balanced the emotional state, he's then looking at a blood test and he wants to know where there's an excessive mineral. Is there a heavy metal? Is there something causing a gravitational pull to increase or worsen the situation? And in many cases, they're finding that calcium is the problem. So in this case, he made calcium at a ratio over here of 3 to 1. So he made the Gans of calcium 3 to 1. He put the stronger one here and the weaker one here, and then the forces, the balanced, as per this image, and the field forces set up through the breast to draw out or to reduce the impact of the calcium's gravitational pull, continually pulling more and more into that tumor. He also used food plasmas, food ganses, to nourish the water, to provide the water with fields, so as to increase the nutritional uptake without forcing the need to eat more food. These are a couple of the health units with the field effects from those units. And in this state, the person was required to stay for an hour or more, 3 times a day, right the way through the process. At this point, there was an assessment made, and there was no malignancy found. So the breast was breaking up, releasing the calcium, retracting, but there was no malignancy anymore. Everything retracted, and now Dr. Rodriguez will be able to help this woman with plastic surgery, and there is again no malignancy. Thank you.